I'm confused today, if I'm feeling scattered today and I see you and it looks like you're all put together perfectly, it'll make me even feel worse. And especially like with social media, everyone posts their pictures on Instagram or Facebook or LinkedIn or TikTok or Snapchat or wherever you go. And you start seeing that, people posted their best pictures in that area and they start looking like they have their world together, which of course has us believe that our world must be really defective and really deficient. And then we are pretty sure there's something wrong with us. And we want to go to the doctor to get confirmed that there's something wrong with us and to get the proper treatment, which in fact, unfortunately, often causes the symptoms that it's marketed to treat. So it doesn't only perpetuate the symptoms, it actually at times can cause the actual symptoms that the treatment is marketed to deal with.
It's such a fascinating area. And I read that you'd lived in different places all over the world. Do you feel that some places have a better attitude towards these things? I'm going to use a word that I know can irritate some people, more resilience, because it's a word that does make sense to me. Some areas, some countries, some people just seem to have a bit more resilience.
More resilience, you're saying?
Yes,
Yeah.
resilience.
Well, I don't know if it's actually the people who have more resilience. I think there are areas in the world where people are less interested in picking off a diagnosis.
Right.
Like they're less, we all have resilience. Every one of us has resilience. If you're still breathing on this planet right now, you have resilience. Count on it. It took something to get this far in your life. It just did. And to find, to keep yourself organized, to get out of bed today, to actually get dressed, to eat whatever you've eaten, to start a conversation with the people in your world, to have gotten to where you needed to be or not, to have taken a shower or a bath, or to have taken care of your pets or your children, whatever you're doing to get through this world today, you are massive resilience. You are massively creative and you have massive resilience. There's no question about that. That's the minimum that it takes to get through the next minute in life. So, what happens is in some areas of the world, mental illness is not seen as an affliction, it's not seen as a deficiency. It sometimes can be seen as just an imbalance that needs a conversation to rebalance. Some of the African nations, that's what they do. They don't have very many psychiatrists. So they have situations where you just go talk to somebody and they don't even have to be trained. This isn't someone like a social worker, or a family therapist, or a psychologist. This can be there's one country that has what they call the orange picnic benches. And you go and speak with a grandmother who's actually sitting on those benches, waiting to listen to you and then converse with you and reassure you that life's going well. And the cure rate for that type of conversation exceeds the cure rate in the Western world. People get better instantly by having a conversation and by being heard for who they really are. We want nothing more in this world than to be heard and seen for who we really are. That's true for all 8 billion of us. We want nothing more to make a difference, but to actually be seen, respected, heard, and known for who we really are. And when we can get somebody who can assure us that they have heard us and connected with us, that's where healing really begins.
Isn't that just it's
It's not anything radical,
it
really. You
makes
know that stuff. You've
yeah.
known that since you were a child.